Thank you so much. I'm really excited to welcome the next speaker on stage for our session on Africa CDC's New Deal. I call the Director General for the Africa Center for Disease Control and Prevention, Dr. Jean Kaseya. Dr. Kaseya?
Thank you. Thank you, Rumbi.
So, Dr. Kaseya, this session is titled Africa CDC's New Deal. And Africa CDC is currently in the process of gaining more autonomy from the African Union, which includes having a Director General, yourself, instead of a director. Can you take us through some of the changes that the agency is going through and how this will help bolster health security?
Thank you. Let me first quote President Ramaphosa when I met him a few months ago. He said, having Africa CDC and more having autonomy of Africa CDC is one of the best decisions that we made. And I agree with him. Why? Let me try to convince you. The first one, it gives us opportunity to put in place what we call the governing mechanism. With this governing mechanism of Africa CDC, we have what we call the Committee of Head of State. We have the governing board and we have what we call the advisory technical committee. But the Committee of Head of State is a game changer. Today, if you want to have a decision approved by AU Assembly, it will take you at least 4 years. But for us, having the Committee of Head of State, it takes us a few months. Let me give you an example of the decisions that they approved in February 2023. We use this governing board where ministers are sitting to push the local manufacturing agenda with the continental pool procurement mechanism. And then we went to the Committee of Head of State, 10 of them. They approved that. Directly it went to the AU Assembly. If the Committee of Head of State was not there, we'll have 5 steps before reaching the AU Assembly. This is one of the outcome of the autonomy. The second one is about the flexibility to develop our vision. And we have our new strategic plan 2023-2027 with 6 priorities summarized into 3 major flagships. The first one is pandemic prevention and response. The second one is local manufacturing. The third one is health system strengthening. And this flexibility is allowing us also to support the third agenda that this flexibility is giving us, local manufacturing. Why we are bringing this local manufacturing as a standalone agenda? Because, as I have to say it every day, local manufacturing is the second independence of Africa. We will not move if we don't learn from COVID. And one of the major lessons from COVID was we didn't have access to health commodities. And this is why we said, let us strategize around this agenda. And today, we are really leading the agenda. And you know, in the past, we have this program called PAVM, Partnership for African Vaccine Manufacturing. From 2023, Head of State, they decided to upgrade that to what we call Platform for Harmonized African Health Manufacturing. It means now Africa CDC is not just leading the agenda of vaccines, we are leading the agenda of vaccines, therapeutics, diagnostics, and all health commodities. And this is a game changer. Now, when I'm sitting with a minister, I can say, your country cannot manufacture a vaccine, but you can manufacture this diagnostics. You can manufacture that one. You see, this is also my role, because I'm at political level and strategic level, to talk and negotiate with countries. Let me talk about financing. This is also another game changer. This autonomy is giving us more flexibility in terms of financing. Because, as you know, we are putting in place the African Epidemic Fund. This is the vehicle where we can start to receive all funding from member states, from partners, from even our communities, because we have this innovative financing mechanism. Maybe we can talk about it. And that one will be the platform to better support our countries on more flexible way. By doing that, this autonomy is giving us opportunity to better and quickly respond to countries' requests. We saw it last year. We had cholera outbreak in Southern Africa. You saw Africa CDC bringing all head of state, organizing a meeting, a summit of head of state of Southern Africa to discuss cholera outbreak. And lastly, it's so important. It gives us also strong political convening power. 3 days ago, I organized a meeting attended by 52 ministers of Africa, 52, out of the 55 countries that we had. Even the room was for 80 people, we received 200 people. And this meeting helped Africa to come with one voice. And this is the voice that we are making for pandemic agreement. It means the autonomy of Africa CDC is the game changer for health security in Africa.
Thank you so much for that. I want to go back to pandemic security, but before I do that, you're really describing an agile Africa CDC, and and I feel like the goals that you've described are really bold goals and definitely something that could help health security. But I also understand that there are challenges. I think during the 7th anniversary celebration, you highlighted that there are challenges with funding. They're also challenging with personnel. Can you take us through some of the challenges in your growth stage?
I just come from a meeting with 12 ministers. They wanted me to talk about challenges to achieve the universal health coverage. I said, let us be led by data. Because if you are using data, you are convincing even leaders. My role is to convince my leaders to bring more resources to the health sector and to convince partners to know that this is the best way we have to deal with health in Africa. Africa, we have almost around 16% of population, the world population, but we are carrying 23% of the global disease burden, while we have only 3% of health workforce in Africa. We are just using 1% of the total health expenditure in the world. It means you see the gap in when we compare the global disease burden, when we compare the HR, human resources, when we compare money that we are using. This is a major issue. And to be more concrete, Rumbi, out of 55 countries, we have only 10 countries, 10. It means less than 20% that can say today they are well staffed to address any public health threat. And this is why we are working on that. We are working in these two components, human resources, how to bridge the human resources gap. To bridge it, we need first to continue to train health workers, but also to retain them, because migration of health workers in other continents, I was talking with my sister, Dr. Balki, my best friend, the regional director of EMRO. She was telling me one of the major issues in EMRO is migration of health workers. It's also my job to stop that, to think about how to stop that. But we need also to see how to bring communities close to health centers. This is why we need community health focus. And we are promoting this agenda of 2 million institutionalized community health workers in Africa by 2030. And what we did, Rumbi, it's important. What we did, we managed also to bring to the AU Assembly the appointment of President Bola Tinubu of Nigeria as the champion for the health workforce. You can imagine we are bringing the political agenda, the strategic agenda, the technical agenda to solve the issue. Then you are talking about finance.
Yeah,
Finance,
I want to go into all that, but I want to. I have to interrupt you because I have a lot of questions for you, Dr. Kaseya. And
I'm there for you.
One thing I want you to touch on before we go any further is we had spoken a little bit about the pandemic treaty, and before we actually came to WHA, you had outlined the African priorities for the pandemic treaty and how it needs to work for Africa. Are you surprised that negotiations broke down, and what do you want to see going forward? Unfortunately, I have to give you just 3 minutes for this, so that we'd be able to cover quite a lot in this session.
This question needs more than 3 minutes.
Can we make it 5?
Okay. why it need more than 3 minutes? I think you saw the statement from Tedros, my brother. He said the 77 WHA will be historical because we are discussing the pandemic agreement. I'm not surprised. When you lead Africa CDC, you cannot be surprised. You have to be prepared for all scenario. What did we do? Maybe colleagues here, they don't know. But for Africa to continue to negotiate, we needed a clear mandate from our head of state. What Africa CDC did, we went to convince the Committee of Head of State, 10 of them, to go to the AU Assembly and to request special permission for our negotiators to continue the negotiation because we are expecting to have the pandemic agreement in May. And you know, in Africa, you cannot sign a document like that if you don't go back to head of state. Then we requested a trust from head of state for us to continue to negotiate, to sign the agreement, and to report. Africa will report back to them in February 2025. But they said, Africa CDC, you need to provide strategic, political, and technical support to negotiators. This is what we are doing. And you see, I think on the 23rd of April, when we saw that we didn't make progress, we called all ministers of health, all ambassadors and negotiators in Addis Ababa. We discussed, we agreed on what we call the way to move forward based on the common African position that was approved in February 2023. This meeting gave us clear guidance on how to finalize with the pandemic agreement. When I landed here, I saw the progress. Let us say we made huge progress. We managed to green around 75–80% of the text. We have still few pockets. Then, as I'm telling you, we had this meeting 3 days ago to unify the African voice. And yesterday you saw the South African ambassador on behalf of all African countries making the statement saying, we want to finalize this agreement by end of 2024. This is our position. And we are linking that because Africa needs this pandemic agreement. The world needs the pandemic agreement. This pandemic agreement is the way to put in place another governance of the health matters in the world. Because we can't continue with what we are doing before. You see, that one is really where we are moving. Now, because there is disagreement, there is a drafting committee sitting. They started today. We are following that. I will receive a report. I will meet all ministers maybe tomorrow. We'll see how we can move forward with this agreement. I think for now, I'm still positive. Yes, last week, WIPO, they signed an agreement that took 25 years to negotiate. I don't believe that the pandemic agreement will take 24 years because at that time, maybe I will be retired. I want it very soon to secure us because we don't know when the next pandemic is coming.
So I'm going to make a request on stage while I have you here. Because I've limited time, I'm going to ask for an additional interview where we can dig more into these topics because I have follow-ups on the pandemic treaty, but I'm going to move on to the next question and I will request that I get an interview with the DG later on. Yeah. So one of the things that we recently reported on Africa CDC was the AU audit that you requested. Yeah. This looked into whistleblower complaints that emerged about your leadership. Yeah. What are some of your key takeaways regarding the audit, and how do you plan to implement these recommendations?
As you said, I requested this investigation. You know, there is a culture in AU. Every day, when I landed in AU, I was briefed by the senior management that every day people are sending anonymous letters against each person. It's not my culture. I was even surprised. But I'm leading an organization where I want transparency, accountability to be the rules, to be principles. And when there is any allegation, I take it seriously. Even if I was advised not to move there, I say, no, I want this investigation to take place. This is why I requested that. But let me give you some lessons. First, In addition to what I requested, there is a major donor to Africa CDC who conducted independent investigation, Mastercard Foundation.
And can you give us tidbits from that
what was the
investigation?
conclusion from Mastercard Foundation? All allegations are false. It's public information because the report was shared with me and the AU chairperson. What was the conclusion from the AU? They said allegations are false, but we are working on some critical component, mostly due to when Africa CDC was under AU and MOUs that Africa CDC signed with some implementing partners. How can we move forward with that? Because there are some components that we still have to improve. I think I'm so glad that we are putting in place this strong governance, accountability, transparency mechanism of managing this organization. Because the way we are managing Africa CDC is like a private sector. We are led by result. We are led by concrete actions. And someone was telling me, let us consider that Africa CDC, Awuda NEPAD, and FCFTA can also support the new generation of AU leaders and strategic thinking. I think this is what we are doing. This is why we have strong result. This is why we have confidence of our communities, because let me tell you, if I was not respected, if I didn't have support from member states, I would not have a meeting with 52 ministers. Let me tell you, each country I'm going, I'm meeting head of state because they respect me and they know my values. This is this kind of values that we are promoting in Africa CDC.
And then in terms of the values that you're promoting in Africa CDC, can you take us through some of the practical things that you're doing? You talk about changing the management of the organization because the organization is also growing. What does that look like practically?
Everything starts with the vision. What is the vision? For us, the vision is the strategic plan that we had, 2023, 2027. From the vision, you look now what could be the best structure that can help you to achieve your vision. And we went through this exercise to design an organogram for Africa CDC. Let me tell you, we didn't have any director in Africa CDC before. Currently, we are recruiting 12 directors. Let me tell you, we didn't have more than 3 P5. And we have a number of sectors led by P3 staff. Today, we have more than that. And we are bringing also people with open mind. We are bringing open-minded people from private sector, from UN, from other organizations to come to Africa CDC to change the culture that we have. Today, Africa CDC is really the continental public health agency, and we are leading this agenda.
I'm almost out of time, but I wanted to ask one more question. One thing that you highlighted is when you joined Africa CDC, you heard that there were lots of complaints that come in from people, anonymous complaints that come in from people within the AU. And this audit was sort of catapulted because of these anonymous complaints. Is there anything that you're doing in terms of like organizational culture to ensure that employees are happy? And is there any work that's happening around that?
Yes, as leader, we need to consider all of that. First, to build capacity internally and to make sure that people, they can send their complaint. If you go to our website, you'll see there is a specific place where people, they can file complaint. And I think we need this culture of speak out. We need people to say what they want to say without fear. Second, we are putting in place the ethics office for them to support, and the ombudsman to support when there is any issue. Don't forget that we are a young organization. Don't forget that we are building, we have a huge mandate by being young. Then we are putting in place all of this mechanism, and these mechanisms are helping us. We don't say that in the future no one can say things. No, we are there to take seriously all allegations, to address them, and to move on.
Thank you so much, DG. Unfortunately, I've run out of time, but I want to.
No,
just
I was
highlight-
thinking we still have 30 minutes.
I just want to highlight that you have promised me an interview, so I will
Yes.
be reaching out.
Yes, thank you.